This is my audience. Thank you.
Nursing is a highly revered science that only certified individuals who undergo rigorous training can practice. Medicine is an ever-evolving science, and every day we learn more and more from our predecessors about modern health and human anatomy. One of the greats was Florence Nightingale. Known as the Lady with the Lamp, she led a team of nurses to help military doctors during the Crimean War. She used her experiences there to implement new sanitation and hygiene habits all throughout Britain. These are habits that we still practice in hospitals today. Today I'm going to be discussing the life of Florence Nightingale and her contributions to modern nursing and society. Florence had a bit of a different start than most nurses at the time. She was born to a wealthy and affluent family in May 12th of 1820. The expectations of a normal teenage woman that was born to a wealthy family would be that they would get their education, marry, and then have children and run their households. This lifestyle was unappealing to Nightingale, and so when she told her parents that she wanted to be a nurse instead, they were unsupporting. Over the next couple of years, she worked to persuade her father, who eventually gave in, allowing her to attend Father Theodore Fleidner's Hospital and School for Lutheran Deaconesses. She worked there for 3 months, and then she transferred to Paris to work with the Sisters of Mercy. Now, at this time, she was making a place for herself in the nursing community. In 1853, she completed her training and moved to Harley Street Hospital, where she went and became the manager and the superintendent there. That same year, in 1853, the Crimean War started. The next year, Florence Nightingale received a letter from Sidney Herbert, the Secretary of War at the time. He was telling her that he had heard of her accomplishments and he needed her help. See, the military doctors were overwhelmed and understaffed, and they had little to no resources. Florence agreed to go out and help him. She gathered a team of 38 nurses, and they headed to the Scutari Barrack Hospital in Constantinople. The conditions were worse than they had read about in the newspapers. There was rats and lice infestations all throughout the barracks. And the nurses were also unwelcomed by the military doctors. The doctors were offended that the government would send them women to come and help them in their time of need. However, a few days later, 3,000 men came in from the Battle of Inkerman, and the doctors were overwhelmed. So they finally gave in and accepted Florence and her nurses' help. According to an article written in 2019 on womenshistory.org, education and public history fellow Carrie Lee Alexander states that the nurses brought supplies, nutritious food, cleanliness, and sanitation to the military hospital, and that within 6 months, Nightingale and her team transformed the hospital. The death rate went down from 40% to 2% because of their work. However, the women didn't just bring resources and help. They also brought a sense of calmness and stability after the chaos of the battles that these soldiers had just experienced. This is also where Florence Nightingale got her name, Lady with the Lamp. She would walk at night in between all of the cots, visiting each and individual warrior, changing their bandages and tending to their needs. Unfortunately, after 4 months of their work, they still lost 4,700 men. This enraged Florence because she couldn't figure out what they had done wrong. The war ended in 1856, and Florence and her nurses headed back to England. Upon her arrival, she was gifted a $250,000 war discontinuation gift by Queen Victoria. While she was with Queen Victoria, the Queen asked her what had happened and why they had lost so many men after the battles. This was Florence's new mission, to find out what happened. Unfortunately, after Florence returned to England, she fell sick, and this wasn't a common cold. She was bedridden for 11 years. However, not even a sickness can stop Florence. She spent that time studying her notes from Constantinople to try to see what happened. Because she wasn't just a good nurse and a good leader, she was also an incredibly intelligent woman. She was the first woman to ever be inducted into the Royal Statistical Society. From the From the publications of the American Statistical Association, written in 1916, throughout her life she collected an immense number of pamphlets, reports, and returns, which she skillfully analyzed with telling effect in her campaigns for hospital sanitation and reform. After doing all of her research and reading through all of her notes, she saw a pattern. See, the soldiers were 10 times more likely to die from an infectious disease than they were from a war wound. Their failure was in hygiene and sanitation. She took all of her findings to Queen Victoria and tried to convince her to implement sanitation and hygiene techniques all throughout British hospitals. The Queen agreed. During her time in bed, she also wrote her magnum opus, titled Notes on Nursing, What It Is and What It Isn't. And this is a book that is still used in universities today. She used her war discompensation gift to found the Nightingale School of Nursing, which was the first ever nursing school to be founded. She also received, at the age of 87, the Order of Merit from Queen Victoria herself. In a 2019 article from the Institutes for the Healthcare Improvements website, President of the Certification Board for Professionals in Patient Safety, Patricia McGaffigan, explains that Nightingale asserted that the entire healthcare team should be held accountable for safe, high-quality care, what we at IHI call total system safety. So as you can see, all of the systems that were created by Nightingale are still used in modern hospitals today. Nightingale revolutionized modern nursing and medicine. She defied social standards, and because of that, our world is forever changed. Medicine has been so thoroughly advanced that it has increased the human lifespan and bettered the human quality of life. One of the people we have to thank for that is Florence Nightingale and her lifelong dedication to the betterment of nursing. She was a strong leader and an intelligent woman, and she's an inspiration to women everywhere. Thank you. Wait, that's not it.